Oral questions by members.
Leader of the Official Opposition.
Thank you, Mr. Speaker. This Premier has made it very clear that he does not support an oil pipeline from Alberta through the North Coast. He's also made it very clear that he will not support the lifting of the ban on tankers. Given that Alberta and the federal government seem to be approaching an agreement to do this, is the Premier prepared to change his position and support a nation-building project?
Minister of Energy and Climate Solutions.
Thank you. Honourable Speaker, the oil tanker ban on the coast protects BC's community and BC's economy. The Coastal First Nations have spoken strongly of it. The Premier has. Every member of our caucus supports that oil tanker ban on the North Coast, Honourable Speaker. With respect, Honourable Speaker, to possible agreements, and I understand there's speculation about that today, but no obvious agreements, I'd say this. A pipeline across northern BC, a bitumen pipeline, has no proponent, no route, no plan, no possibility of take-or-pay contracts, would be subsidized publicly by tens of billions of dollars. And yes, Honourable Speaker, our position is that we should support nation-building projects like the North Coast Transmission Line that are in the interests of British Columbia. And I would like the Honourable Leader of the Opposition, whose own riding would benefit from the North Coast Transmission Line, to stand up in this House and say he supports it.
Leader of the Official Opposition, supplemental.
Thank you, Honourable Speaker. And if the Minister would love to ask a question, we can switch sides anytime you like. Mr. Speaker, when the Trans Mountain Pipeline was built, this Premier and this government said they would use every tool in the box to stop that project from moving forward. When that project was moved forward and approved, they created delays and cost overruns in the tunes of billions on that project because of their opposition to this, a nation-building project. And now, Mr. Speaker, we are in the same situation where there's a project coming forward, there are First Nations supporting it. We're going to see this come forward in an agreement between Alberta and the Prime Minister with regards to moving oil and a nation-building project. So the question I would have through you to the Premier is this. Does he plan to use every tool in the box to stymie and cost overrun yet another nation-building project?
Minister.
Well, Honourable Speaker, it's good to see that the British Columbia official opposition doesn't support nation-building project, doesn't support nation-building project in BC, opposes nation-building projects in BC, and supports them from other provinces, Honourable Speaker. A project has to exist, Honourable Speaker. It has to exist in time and place. But I can tell you, Honourable Speaker, you look at British Columbia, and you see 4 nation-building projects approved by the federal government. Don't know where the opposition stands. We named 18 major projects. They opposed 12, Honourable Speaker. I think, Honourable Speaker, that MLAs in British Columbia should support British Columbia, and certainly the opposition isn't doing that.
Member for Peace River South.
Thank you, Mr. Speaker. After our ER closures in Tumbler Ridge nearly killed both the mayor and a councillor on the same night. Both suffered abdominal emergencies and both ended up requiring emergency surgery. The mayor was sent to Fort St. John, a 2-hour drive away during an emergency. Will the minister commit today to restoring after-hour ER services in Tumbler Ridge, or does someone need to die first?
Minister of Health.
Thank you. Thank you so much, Honourable Speaker. It's been a really tough time for the people living in Tumbler Ridge to know that emergency services had to be stopped at night and on the weekends. Mr. Speaker, having a shortage of physicians in the community meant that the stress and the burden placed on those remaining staff people was too much to bear, and Northern Health made a very difficult decision. But to make sure that people get the help they need when they present at the health centre or when they call 911, they added ambulance resources to the community and to the region, Mr. Speaker, because it's vitally important that people get the care they need when they need it, where they need it, as quickly as possible. Now, I know that the community is working closely with Northern Health, and I appreciate the member's interventions, the conversations that he has had directly with me and with Northern Health, working together with the Mayor. I'll be meeting with the Mayor when he's down here next week, Mr. Speaker. We're going to continue to do everything we can to support Northern Health in recruiting more physicians so that we're able to move towards restoring services in Tumbler Ridge, and in the meantime, do everything possible to make sure people have that care when it's needed.
Member supplemental.
Thank you, Mr. Speaker. Northern Health leadership publicly said that there were too many ER visits and that the ER should be reserved for dire emergencies, such as shortness of breath or chest pain. Clearly, for Northern Health, an abdominal emergency does not count as dire. Local, Dr. Charles Helm has publicly called Northern Health's advice irresponsible. Adding insult to injury, Northern Health told residents that closing the ER after hours was actually good for them because they would supposedly get faster care. Does the minister agree with Northern Health leadership that ER closures are good for the people of Tumbler Ridge? Yes or no?
Minister of Health.
Thank you, Honourable Speaker. I totally disagree with the member's characterization of this. There are professionals at Northern Health working closely with local medical staff to make the best decisions possible with the resources and the shortages and the strains that they're facing. Mr. Speaker, it's inappropriate to speculate on individual cases and to speculate on what may have happened. What's vitally important is that Northern Health continues to work closely with the community, that recruitment efforts are ongoing, and that more broadly, British Columbia our government continues to focus on these recruitment efforts, because we know that the strain being placed on rural ERs is incredibly difficult for local communities to bear, and that's why we're taking action to recruit more physicians and nurses from places like the US. That's why we're speeding up credentialing, Mr. Speaker. It's why we're going to continue to build more medical training seats for the nurses and doctors that we need in the years to come. Because, Mr. Speaker, whether you live in a small town or whether you live in a large urban area, you deserve to have the care that is there for you. And that's why we're going to stay focused on this work at hand. Thank you, Mr. Speaker.
Leader of the third party.
Thank you, Honourable Speaker. I rise with a heavy heart today, and I'd like to warn the House that the subject of my question is distressing. I'm humbled to have been given permission to share this story. 2 years ago, Bowen Island teenager Maya Cassidy made a request under the Freedom of Information and Protection of Privacy Act to receive her medical records. The records pertain to recent hospital visits where she was admitted for treatment of a mental illness. The FOI request was made without her parents' knowledge. After receiving her records, Maya went online to look up terms related to her diagnosis. The search results indicated that her illness was untreatable. That information was the last thing found on Maya's phone. Her mother, Hillary, believes that she interpreted her situation to be hopeless. Maya died by suicide later that day. My question is to the Minister of Health. Why are vulnerable minors being left to interpret potentially harmful information without support from mental health professionals?
Minister.
Thank you, Honourable Speaker. And first to the member, to Maya's family, what a tragic and heartbreaking circumstance this is. And it's difficult for the House to hear, and I know that it's difficult for the member to bring this up. The death of any child is absolutely devastating, and I know that our hearts go out to her family, her friends, and her community. Mr. Speaker, I will be pleased to talk with the member more about this particular case. We always want to learn from tragedies like this and do everything we can to prevent them from happening again. And Mr. Speaker, it's also why we have to continue focusing on the supports that youth need so that no youth like Maya feels hopeless about their situation, and that they know there is a place to turn out, reach out for help. And Mr. Speaker, that's why we're going to continue our work to create a youth suicide prevention network, a way of assisting clinicians in helping to identify issues, providing supports for youth. Mr. Speaker, we're going to continue our investment into Foundry, providing one-stop shops, places that are safe for youth to come in and seek the supports that they need. Mr. Speaker, nothing could be more important. This government is so committed to this work, and I'll be very pleased to work with the member following up from this. Thank you.
Member supplemental.
Thank you, Honourable Speaker. Thank you to the Minister. With respect, this isn't just a particular case. Since their daughter's death, Maya's parents have become fierce advocates for youth mental health. They're calling for systemic change to ensure Maya's death is not repeated. They report that FOI requests are common amongst minors hospitalized for mental illness. Other children are at risk. We must ensure that these reports are delivered with the support of mental health professionals. But as my constituency staff have worked with Maya's parents to advocate for change, they've been directed first to the Ministry of Health, then to the Ministry for Citizen Services, and then back to the Health Authority. No ministry seems to want to touch this. My question is for the Premier. Which one of your ministers will take responsibility to ensure this doesn't happen again?
Minister.
Thank you, Honourable Speaker. I don't want Maya's parents to have any challenges reaching out to our government for help. So my commitment to the member, regardless of what ministry I represent, is to make sure that Maya has access to the people, Maya's family has access to the people that they need to talk to, so that we as a government, regardless of which ministry, learn from this tragedy and make the changes so that we can do everything possible to prevent this from happening again. Thank you.
Leader of the Fourth Party.
Thank you, Mr. Speaker. What if I told you that the government has a foreign welfare program where they take money from citizens and give it to non-tax-paying guests? The BC government is spending $2 billion on university student housing, but half of this money, nearly $1 billion, is given away to foreign student housing, students who don't even call Canada home. This government is prioritizing and spending money on guests instead of our own citizens. Will the minister act immediately to cut this $1 billion foreign student subsidy and give this money back to British Columbians?
Minister of Post-Secondary Education.
Thank you, Mr. Speaker, and I'm happy to rise for my first time in this House to answer a question in question period. It's unfortunate. But it's unfortunate that the question has to be riddled in such rhetoric about the diversity of our province and of our post-secondary institutions that truly makes our province so great. On this side of the House, we know that the diversity of our post-secondary sector is what truly contributes to the growth, the innovation, and what is going to lead BC to being the engine of Canada. That is what we invest in. And if we want to talk about student housing, I'm happy to do that, because we have invested, our government has invested over $2 billion in creating student housing for students across our province, so they have access to accessible, affordable student housing that is safe for all students. We will continue to invest in students, we will continue to invest in our post-secondary sector, and we will not back down for ensuring that all British Columbians have access to relevant, accessible, affordable post-secondary education whenever they want to access it.
Member supplemental.
Yes, thank you, Mr. Speaker. Foreign students are meant to be a net benefit to our country. We bring in the best and brightest so that they can enrich our experience, not to subsidize theirs at the expense of BC taxpayers. Meanwhile, our own students can't find jobs and can't afford homes. It is a $1 billion betrayal, Mr. Speaker. My question again, will the minister act immediately to cut this $1 billion foreign student subsidy and give this money back to British Columbians?
Minister.
Thank you, Mr. Speaker. I'm truly perplexed at the line of questioning when we know that international students have funded so much of our post-secondary institutions for so long. They have paid disproportionate amounts of tuition to uphold our post-secondary institutions, and this is something that we're seeing the effects of it from international student cuts at the federal government level, and we're seeing the impacts it's having on our post-secondary sectors. I'm not sure where the member is getting her information, but we know, again, that the diversity within our post-secondary institutions, the access that we have to post-secondary is the reason that BC is a world-class post-secondary sector where people from all around the world are coming here to get an education. We will continue to ensure that BC is leading that charge. We will continue to ensure that we are training the bestest and brightest in our province to ensure that we are that economic engine of BC, and we will continue to lead BC and Canada always.
Hear, hear.
Member for Surrey Serpentine River.
Thank you, Mr. Speaker. Local governments are forced to be the backstop for this government's failings, left to fend for themselves in neighbourhoods they don't recognize anymore. The latest being Surrey Mayor Brenda Locke and Council unanimously rejecting the BC housing proposal that would see seniors mixed with people that have needs that far exceed the community's capacity and nowhere near the supports they needed. Hundreds turned out to oppose this proposal. The evidence is clear. This model attracts dealers and petty criminals. People are seeing and experiencing escalating crimes on a daily basis. More and more cities and mayors are rejecting these proposals in a desperate bid to keep their communities safe. Will the minister commit today to stop the mix of drug and alcohol abuse housing and public disorder tearing apart communities by immediate pivot away from this failing model? Yes or no?
Minister of Housing.
Thank you, Mr. Speaker. And while I disagree with the characterization of the question, I welcome the opportunity to talk about the important work that we're doing across the spectrum to provide housing and supports to people who need it most. And actually, I'll note that the member opposite was supportive of this type of housing during her time as mayor, because in that role, as we do, folks understand that the alternative to encampments, the alternative to people sleeping in streets or doorways is providing shelter beds, supportive housing beds, and the supports that go along with them, mental health supports, addiction and recovery supports, that allows our most vulnerable neighbours.
Members, members, order. Please continue.
These types of housing and supports allow our most vulnerable neighbours to come inside and get back on their feet. It improves safety for those individuals and safety for our broader communities. Without these supports, as members across the... I can wait.
Members, Minister has the floor. Please conclude.
Members across the aisle have cut funding to these supports, have opposed shelter and supportive housing.
Members, come to
You can take all
order.
the time you want, folks. It was your question.
Shh. Members, Minister.
Without supportive housing, more people remain outside, more people remain in encampments. Those are not safe options for communities. So we will continue to work alongside local governments, alongside community-serving organizations, to bring people inside and support them along their path to recovery.
Member for Richmond Bridgeport.
Thank you, Mr. Speaker. 2 years ago, a person tragically died in a fire at the Oak Street Bridge encampment. And the situation has become worse since then. The City of Richmond wrote to the Ministry of Transportation asking for action. And yet, this NDP government has failed to take action. Families with newborn children now walk through that area to reach the nearby SkyTrain station, facing needles on the ground and aggressive behavior on a daily basis. When will this NDP government finally act to ensure the safety of our citizens, respond to the concern of the City of Richmond and the concern of my constituents, and provide real, I'm talking about real support to the homeless individuals under the Oak Street Bridge?
Members, Government House Leader. Members, Government House Leader.
Thank you, Honourable Speaker, and I appreciate the question from the member. I want to assure the member we take these issues very seriously when it comes to encampments, both in terms of whether they are on provincial road right-of-ways, but also in other areas. And we work with communities and we work with the Ministry of Housing, my ministry does, to find solutions to be able to, whether it's to starting to move people on into the kind of housing that's required or to get them to supports. We work with communities to identify what are some of the causes in terms of the situation for that encampment starting. If it means closing things down, such as we are doing at the Cole Road in Abbotsford, we will do that. We will take the measures to do just that. But at the same time, Honourable Speaker, I must admit, I find it somewhat fascinating that the member stands up and demands action to provide services for people and places where they can get the help and the housing that they need. And just before that, Honourable Speaker, a member of the same party, is saying, we don't want this kind of housing in our neighbourhood, Honourable Speaker. Talk about hypocrisy. They want to have it both ways, Honourable Speaker. They want to have it both ways. You're either in favor of helping people, as we are, or you're all over the place like the opposition, Honourable Speaker.
Member for Columbia River Revelstoke.
Thank you very much, Mr. Speaker. Sadly, but not surprisingly, locally elected officials from my riding received a lot of big fat no's from this government this past September at UBCM. Angel Flight East Kootenay, my constituents' only free transportation to medical appointments in Kelowna and Vancouver, has their government funding running out very soon. This is an essential service, Mr. Speaker, for those that are tens of thousands of East Kootenay residents that are run by volunteers at Angel Flight East Kootenay and generally supported by private donations. Will the minister commit today to a long-term funding model for those that need care hundreds of kilometers from their home?
Minister of Health.
Thank you so much, Honourable Speaker, and thank you to the member for the question and for speaking up for rural residents that deserve the same access to health care as any resident in this province. Mr. Speaker, that's why we are working to support communities like those that the member represents, knowing that they face particular barriers and challenges in accessing health services, having to cross mountain passes, traveling in the winter, the cost, the time is something that rural residents deal with. It's a very, very real, and it leads to worse health outcomes for people. That's why we've established the Travel Assistance Program. Mr. Speaker, that's why we expanded the Travel Assistance Program a couple of years ago. Mr. Speaker, it's why we are proud to have been able to support services such as the one the member represents or is speaking about, Mr. Speaker, and I'll be happy to continue talking to him, his residents, about the ways we can continue to support that, because nothing could be more important, making sure that rural residents have access to the healthcare services that they need.
Member for Langley Abbotsford.
I'm really hoping I get more than the usual word salad of a response from this minister. Speaker, families across Fraser Health are facing a crisis. Delta ERs have seen repeated closures, forcing patients into Surrey Memorial where wait times stretch longer than 14 hours. In Abbotsford, Speaker, it isn't much better. People are waiting 12 hours just to be seen. Yet the Fraser Health CEO is paid over $500,000. Speaker, how is it possible with that level of executive compensation, Fraser Health still can't deliver the most basic level of emergency care for our residents?
Minister.
Thank you so much, Honourable Speaker. I know that long wait times in emergency rooms are incredibly frustrating for people. When you are sick or when someone you love is sick and you need to wait in an emergency room, it creates a lot of anxiety and angst for people, Mr. Speaker. I want to be clear that we know wait times fluctuate and it depends on the time of day, but every patient is triaged with the acuteness of what they are facing, and they are seen quickly when the severity of their illness or...
Members, question has been asked. The minister is answering now.
The sickest people are always seen first and fastest, Mr. Speaker, and that is the way that it should be. But we know there's more work to do, and one of the ways that we can prevent people from having to go to the ER in the first place is to build up our primary care system, Mr. Speaker, and that's why we have taken steps like developing the longitudinal family physician payment model, one that has seen 1,000 new family practitioners come to this province, practice here, attaching hundreds of patients every single day, Mr. Speaker. It's why we've expanded the scope of practice for pharmacists so that people don't need to go to a doctor, and if they don't have one, go to an ER to do simple things like refill a prescription or talk about something like a urinary tract infection, Mr. Speaker. There's more work to do. You can bet we're going to continue doing this because we know how important it is to build up the healthcare system here to ensure people have the access to a family practitioner, to a nurse practitioner, to the people that they need to see to get the care that they deserve.
Member for Kelowna Mission.
Mr. Speaker, talk about a functioning healthcare system. The ambulance paramedics say there have been 250 hospital and ER closures across the province this year. Lillooet alone has had 45.
Shameful.
Doctors, nurses, and patients tell us they're at their breaking points, and nothing has actually changed.
Shameful.
Even as the CEO of Interior Health left, the CFO stepped in as the interim CEO, then became the permanent CEO, all handpicked by a board chair who is himself the former CEO.
Shameful.
When will the health minister recognize the pattern and make an actual regime change to get Interior Health back on track?
Here, here.
Minister of Health.
Thank you so much, Honourable Speaker. First, I want to say that the leadership in Interior Health has my confidence. I know that they are doing everything they can to strengthen the healthcare system in interior communities. And in fact, despite the fact that the member would have us all think that everything is falling apart,
Members.
He completely ignores the progress that we're making. We did not get into this situation overnight. We're not going to get out of it overnight. We are going to get out of it by determined work. Mr. Speaker, we have seen the progress that this government has made, seeing ER disruptions reduced by 25% over the same period last year. But, Mr. Speaker, the member brings up Lillooet, and I want to talk about Lillooet because Lillooet is a success story. It is true that Lillooet has had emergency room disruptions, but they have not had a disruption since July 28th. Why? Mr. Speaker, Speaker, it's because of the leadership that is being shown by the community and by Interior Health. It is by the recruitment successes that they have had, with 4 new practice-ready assessment physicians arriving in Lillooet in 2025, 1 in March, 3 in September. They are supporting primary care, they are supporting the emergency room, and that emergency room has not closed since. That is an example of success. That is the result of hard work, and that is the work that we are going to continue to do.
Member for Surrey White Rock.
Wow. That's the bar for healthcare in this province. Absolutely staggering that an emergency room has not closed since July. And that minister takes a victory lap on that? No. Absolutely pathetic. And the fact is this, 250 hospital closures this year. This year. We've had 55 closures in if you want to stand up and answer a question, go for it.
Member has the floor. Shh. Member has the floor. Please continue. Members, please continue.
Well, maybe this minister should actually start listening to healthcare workers, because what they would say is that the progress that this minister takes victory lap after victory lap for ain't working. And the fact is, we've seen Delta close time after time. We've had 14-hour waits at Surrey Memorial. We had an absolutely tragic story told in this House because somebody couldn't access medical equipment at the right time. We hear stories about seniors having their health care cut. We hear stories about angel flights being cut. This minister's disconnect is completely staggering. But the fact remains, healthcare in this province has gone down, while executive compensation has gone up. So if the minister is one day going to listen to healthcare workers, whether it's in her caucus, this caucus, or anywhere else across this province, she's going to hear the same thing.
Question, member.
Sorry if this is an inconvenience, and I imagine it would be for these guys,
Let's
but the question is this, is how can this minister defend compensation this year that exceeds $13 million for executives and health authorities, and the fact is, we got healthcare workers that are saying this minister is failing her job every single day.
Thank you. Thank you. Minister.
I know this member would like to deny the progress that's being made in hiring 1,000 new family doctors, in tripling the number of nurse practitioners,
Members.
adding 175 new cancer doctors. Mr. Speaker, that
Members.
hiring over 900 internationally trained doctors, Mr. Speaker. That is the result of progress of hard work that we are not going to stop. But I know what they would do if they were given the chance, and that is to make sure that those people that we are hiring into our publicly funded universal healthcare system would be drawn out into two-tier private medical care. I dare them to say they wouldn't. Thank you.
The bell ends the question period.